Hi everyone, my name is Kelly and I'm from Cortico. Today I'm here with Ashley and our special guest, Supreet. Today's podcast is going to explore the world of telehealth and seniors. Some people may think that these two are opposing words, so let's discuss why there is such a large gap between the older population and telemedicine. And now here's a warm welcome to Supreet. Supreet has been managing a geriatric practice for over 5 years, working with seniors on the front lines and have seen firsthand how difficult it is for older adults in this tech-driven world.
So, Supreet, how has COVID impacted your geriatric clinic?
I would definitely say that in the beginning of COVID, a lot of our patients were frustrated. We as healthcare providers were frustrated too. It was completely new to us. A lot of our patients, they didn't know how to reach their doctors. They needed prescriptions and, they were vulnerable. They didn't know how to get access to care. Being seniors, they're not quite tech savvy with telemed, so they didn't know how to use computers and stuff. So it was definitely frustrating on both ends.
So do you find that it was a more challenging experience for them when your clinic switched to virtual health?
Definitely, because they weren't really aware of what to expect. And, it being our first time as well, we've never been through a pandemic. We didn't quite know how to prep them as well for the switch.
Yeah, I find that there is a lot of challenging factors that we have to put into place when it comes down to senior patients. And do you feel like that we're kind of forgetting about the seniors when it comes to virtual health?
I think we do, because we assume for example, our age group, or even the physician's age group, right? Physicians know how to use computers, iPads, laptops. That's what they're used to. Whereas our seniors, not everyone has a laptop or even a computer or even a cell phone, right? They're used to maybe even just home phones. So for them, even having access to what everything telehealth can offer, that might not be something that's suitable for them because they don't have it at home.
This might be kind of shocking. I was reading an article not too long ago and I had no idea, but did you know that 13 million seniors face telehealth unreadiness? And that's so scary because it's their health.
Oh yeah.
And it's like there's this digital divide when it comes down to senior patients and virtual health.
Yeah, that's a very crazy number. I did not know that.
Yeah. And so Supreet, I totally agree with you when you mentioned that, a lot of seniors aren't tech savvy, and that can be really scary and sad at the same time. What are some tools that we can use to help seniors feel, more comfortable, using virtual health? Because I understand, a lot of them don't trust seeing practitioners online. A lot of them, may not have the correct lighting or devices to use virtual health. What are some, tools that we can use to make seniors feel more comfortable?
Looking back at it, I'm having an idea right now what we could have done. We had all these spare rooms, right? Exam rooms. Our doctors were working from home. They're empty. What we could have done is just, got seniors inside those rooms, set up a computer there. It's good lighting there. They have access to us as MOAs to help them with any technical difficulties. And that kind of would have been able to prepare them in the future, right?
100%. 100% agree with you. And that's such a good feature to have in a clinic, because a lot of doctors are working from home and a lot of doctors are still paying a lease monthly to have their clinic, running, but, a lot of them are not working in the clinic. So, having that option available for, patients who aren't so tech savvy, I think that's brilliant.
Yeah, it definitely would have helped, because we've had those extra rooms. And even if patients, say, brought their own laptops in, perfect, right? We would have been able to, okay, this is Zoom or this is telemed. This is what you need to click on. This is how you access the video call, everything. And then your next appointment, they don't need to come to you.
Do you think, from your experience of working in a geriatric clinic for 5 years, do you think, in this day and age of a pandemic and whatnot, do you think that, now and even for the future, that we should implement some sort of educational platform for senior patients, showing them how safe it is to, see your physician virtually?
Yeah, I definitely think it's something that we should look further into. Again, like you mentioned before, seniors, they don't feel safe. They don't know if it's the right doctor, all those kind of things. So if we were to start educating them before, say, a pandemic hit, right? They're already comfortable using that system. They've been using it, right? They don't have to wait for a pandemic to hit. So simple things like prescription renewals. Why can't that be done over telemed, right? It saves the seniors time. They're not exposed to certain viruses that are in walk-in clinics, right? Everyone's sitting so close to them. And I know right now we're trying to get back to the norm, but I think definitely in the future, we should have a system that's set up that educates them, whether it's telemed or anything else, anything new. We should definitely, I agree, do that.
Yeah, I 100% agree. I just feel like, I lost my grandma, during the pandemic. And I feel like if things like, an educational platform for virtual health was implemented, years ago, we would have been preventing, things like this. Because like 13 million seniors that face telehealth unreadiness, I think that's just not right. And something should be done about it.
Yeah, that number is pretty unacceptable. That's our senior population. They're the most vulnerable population, especially during COVID, the pandemic. They were the ones that were hit first, and they should have been the ones that received the most care. But unfortunately, the way our system was set up, they weren't prepared for that. And we as healthcare providers weren't prepared to help them either. So, that number, 13 million seniors, is very shocking and it's unacceptable. And we should really find ways to prevent that in the future.
I totally agree with you, Supreet. And I feel like, teaching a senior opposed to telling them that, hey, this is how things are done nowadays, and it's up to you to keep up with the times. And I don't feel like that's fair, because seniors, they could be a little bit slower adapting to, technology. And I find that if you educate them opposed to telling them that, hey, these are the changes, this is how you're going to see your doctor, it can get really scary. And it can kind of like not make me want to use virtual health. Have you incorporated any educational platform in your practice for your senior patients so they can get comfortable using, virtual health?
You know what? That's a really good point, Ashley. When you said educating them, we didn't at first. And we did exactly what you said. You tell them, oh, log into this, do this, you'll come on this page and then click this. And to them, someone who's not used to going on a laptop, that's really hard to do. For us in our age, that's super easy. For someone who doesn't even own a cell phone, only has like a home telephone, that's super hard. So, a thing that we should have done, and I think would have been really, really helpful to our seniors, is we had all these empty exam rooms. Our physicians were working from home. We should have set up certain rooms for seniors to do their virtual appointments in. And us being the MOAs and the managers of the clinic, we would have been able to be there to assist them. They could bring their laptop in, or they could use our computer, and we could say, okay, log in front of me and I'll show you how to do it. And then they do it, we teach them. They get familiar with the system, right? How to use the video call, everything like that. So I think that actually, had we have implemented that in the beginning, would have definitely caused our clinic to run a lot smoother. It would have caused our seniors to not be so anxious during appointments, because that was a really big problem that we had. And it would have just been very smooth on both ends. And I think that would have allowed them to be more confident and have more trust in telemed.
So what it sounds like, it's like you're trying to incorporate kind of like a mentor-mentee workshop for your seniors, kind of like showing them once or twice, and then they can go home and comfortably, see their doctors virtually. I think that's brilliant.
Yeah.
And what do you think? What do you think about Supreet? What do you think about like, being prepared at home with, like, medical supplies, so the seniors are actually getting the most out of their visit?
Yeah, that was definitely an issue that we had in the beginning as well. We'd had our physicians call for a patient, say it was blood pressure, they needed their prescription renewed. The patient didn't know what blood pressure they had at the moment, or they took it in the morning, nothing, right? We're not prepared for that. So, and what that results is safety issues, is the doctor giving the incorrect dosage now, right? And definitely simple things like blood pressure, weight machines, all of those kind of things, had the patient known, like, okay, this is a checklist I need to like knock off before my physician's call. Definitely you get the most out of telemed that way.
Oh, 100%. So, like, just having, like what you just said about having those medical supplies that, majority of people have at home, but incorporating that into your actual virtual health, which is going to provide the utmost, like, the best patient care virtually. My last question to you, Supreet, is, before we let you go, do you think virtual health is here to stay? And what do you think the future outcome for virtual health in seniors is going to be during the times to come?
Yeah, I definitely think that virtual health has been a great asset to our healthcare system. It provides, efficient care, I think, for a lot of our patients, and just simple things like it decreases wait time, right? You don't have patients waiting in our waiting room for 2 hours, sick patients, right? They could be at home. And that keeps us as MOA safe. It keeps our physicians safe, and it keeps other patients safe. Also things like, the white coat syndrome, where patients do their blood pressure at home, and the moment they come to the clinic, their blood pressure rises. And then again, they're getting incorrect medication.
Because they're scared.
Exactly. And then with telemed, we don't have that problem. So I think depending on the patient, virtual care is amazing. And I think going back to what we were discussing, if we had proper education for all of our patients, especially our seniors, we could use telemed for many, many things, and it could replace that interaction with our doctor that we don't need.
Awesome, Supreet. It was really great having you on our podcast. Kelly, did you have any points to add?
Yeah, just the last few things. I just wanted to obviously thank you both for such an amazing discussion. And I think my main takeaway from this discussion is that both parties need to put in the work. It seems like without that educational portion, seniors are left behind. However, if once we approach telemedicine, telehealth to seniors in a fair way, they can put in the work, practitioners can put in the work, and I feel like that's when telehealth and telemedicine can flourish. So thank you so much for your insights, Supreet. I hope everyone has enjoyed this podcast as much as I did, and stay tuned for our next podcast. Thanks, everyone. Bye.